Yep. It feels a lot closer, Adam. So
Yep.
just so that you know. So do you want to explain what's going on with Dynamed?
Yeah. So this is ABSCO's content. It has a large amount of different medical topics with all the relevant information that is being updated pretty much on a daily basis whenever a new study comes. The content is about diseases, drugs, all kinds of information, relevant information for the patients, for the doctors, for the nurses. And all this information is being handled by hand by medical doctors and professionals of that kind. They're organizing the data. They put the most important information, and it has a bunch of documents, tens of thousands or so, which are updated. And as new research is coming, new data, in particular about drugs, if by any chance certain drug is not effective anymore, or some studies show that something is wrong, that information gets entered immediately and so on. And that content is being used for customers to search and provide or find relevant information. As such, the data, besides the content, contains a metadata, which, I've worked on in a few of the projects to update and kind of summarize what the whole topic is about, define some kind of key parameters by which a search can really look through this metadata and narrow down the search if it's a broader topic.
In terms of that, there's kind of feedback. In terms of that last case study that you were talking about, the Dynamed stuff, a couple of things. Let's make sure that when we talk about the customers, you define exactly who it is that's consuming this. But in general, what were the best practices that we're using? What were, the kind of the principles that you used to drive what was going on? And then what are the things that you wanted to stay away from, the things that didn't work?
Yeah. So I think as in any general recommender system, not just these particular, there are a couple of things which are really important and they need to be always addressed. So the architecture should be robust and so on, definitely work reliably. All kinds of electronic, in this particular case, electronic media records or health records are really nice tool to have to provide all kinds of either for storage or for retrieving data or relating different kinds of data from different places. So the data format itself, then security of the data is very important also. This is related either to patients or conditions of patients, so that needs to be really secure and so on. The data storage, the interface that medical doctors, nurses, whoever is using this, need to be in such a way obvious and easy to use, present the information. Again, I'm trying to address these best practices. And in the background, in the engine that drives all this, all kinds of latest machine learning techniques are really relevant to be used because they make all the difference. Having nice interface and very concise data is still not enough if you don't present it, if you don't retrieve it properly and so on. And this over the last maybe 2 years or so, all the innovations that were done in text analysis with the transformer models like BERT model and so on, that enabled really amazing things to find content, to extract the most important thing, the most relevant, match what is really relevant. So that was, we are trying to use that, and that makes really big difference for the experience, for finding the right information, not finding something that is remotely relevant or not relevant, because that kind of discourages users from further search or
So what business use cases did you resolve? So what were the use cases? Where did you start? What problems were you trying to solve?
Yeah. So